Today I'm going to be doing a complete adult assessment on my patient here. Her name is Allie. First we're going to start off with a general inspection. Just by looking at her we can tell that she has good hygiene. She is alert and oriented, and we can check that by asking person, place, and time. She is able to maintain her body. She can sit upright, and she's not slumped over. We can also see that she has a good affect, and she has a good tone of her voice. We can also see that the patient is in no distress at this time. The patient is 5'2", and she weighs 230 pounds. We obtained her most recent vital signs. Her last blood pressure we were able to obtain was 122/76. Her heart rate was 72. Her oxygen saturation was 99%, and her respirations were 18. Her temp orally was 98.6. We're going to be doing a head assessment and looking at the patient's face. So we're going to take a look at her face and see that her head is within a normal size. Everything is symmetric. Her eyes are symmetric. She doesn't have any obvious facial drooping. And we're going to look at her hair and see that her hair is within normal limits for her age and sex. It is thick and brunette. It's even throughout her scalp. Then we're also going to look at the skin tone on her face. She does have pale skin. That's within normal limits. There's no obvious lesions or any large pustules or abscesses on her face that might cause concern. And then we're going to take a look at her nose, and we're going to look to see if her We're going to take a look to see if her nasolabial folds are within normal limits and to see if they're symmetric. Okay, and we can tell that they are just by looking at them. Then we're going to look to see what her mood and affect is. She is calm and relaxed. She's not agitated, confused. Her level of consciousness is within normal limits. She knows where she's at, and she knows the year, and she knows who she is, so that's normal. Her cognitive function is also within normal limits. She's able to comprehend what I'm saying and also able to answer questions. We're going to check to see if the patient's eyes and pupils are reactive to light, to see if they're round. And they are round. They do react to light, and one constricts whenever the light is shown of the other one, so that's normal. Now I'm going to inspect the patient's ears, look in there to see if there's any drainage, and by doing that you're going to take the pinna and pull it up and back to look in to see the eardrum. So we can see that it is a silver gray color. There's no edema or redness. There's no discharge. A little bit of earwax is normal. And do you have any concerns about your ears? Okay. Also looking at the ears, we can see that there's no foreign bodies located in the ears. We're going to inspect the patient's nose, and we're going to see if the septum is midline and if the cartilage is firm and spongy. And then we're also going to look to see if she can breathe throughout each nostril easily. And then we'll look in there to see if the hair is distributed evenly. Okay, so her septum is within midline. I'm going to just feel on the spongy part and over the cartilage. The cartilage is spongy, and the bone is hard around her nose. She has no swelling or edema. The hair is evenly distributed throughout the nose. No obvious signs of bleeding, scabbing, or anything like that. Do you have any concerns about your nose?
No.
Are you able to breathe easily through both nostrils?
Yeah.
Okay. Take a look at the mouth and the pharynx. Say, stick out your tongue. Okay. So the tongue is symmetrical on both sides. There's no obvious swelling, edema. Off palate raises when the patient says ah, and we can see the uvula in the back. The patient does not have any tonsils. She previously had a tonsillectomy in the past, and the mucosa is pink and moist. Look at the patient's neck and look to see that it is midline. It is not deviated to one side or the other. The musculature is within normal limits for the patient. No excessive musculature or muscular atrophy. The vasculature is within normal limits as well. And then we're also going to take a look at the lymph nodes in the neck, and we're going to palpate them to see if there's any that's palpable. Okay, none of her lymph nodes are palpable. Also going to take a look at the thyroid gland and see if we can palpate it. We can feel the trachea. Can you swallow for me? Okay. So the thyroid gland is not palpable whenever she swallows, and that's within normal limits. If the thyroid was enlarged, then there would be reason for concern. Now we're going to take a look at the patient's upper extremities. So we're going to have the patient abduct and adduct her arms to see if she has full range of motion. Just move them. That's fine. And then inwards. Okay. Hand up. Good. Okay. So she has normal range of motion. Any pain with that?
No.
Okay. So her strength is equal as well. She's able to push against resistance, and I'm going to feel for her radial and brachial pulses. Okay, and while she has her arms out, we're going to palpate the epitrochlear glands. See if they're palpable. So they're not palpable, which is normal. We don't want them to be enlarged or inflamed. So we inspected the patient's back off camera, and we could see that the skin is within normal limits. It's dry, intact. There's no lesions or abscesses that we can see. Her spine is straight, and there's no abscesses or cysts on her spine that we might be worried about. And it is also within midline. When the patient bent over for me, there was no pain, and I palpated her bony prominences as well. The musculature on her back was within normal limits. She has good musculature. Also palpated her CVA tenderness, and there was none while I palpated that area. And the scapula was within normal limits. She's able to move the scapula freely without any pain or tenderness. We are going to now assess the patient's lungs. So just by looking at her, we can see that she's not having any labored breathing, no retractions, and her breathing is within normal limits. Her respiratory rate is about 18. So now we're just going to take a listen with a stethoscope to see if her lung fields are clear throughout. Just take a deep breath. So her lungs are clear throughout. There's no crackles, rales, or wheezing. So now we're going to take a look at the chest wall. Just by looking at it, we can see that there's no abscesses and there's no obvious lesions. And I palpated the chest wall. There was no enlarged lymph nodes in the chest wall that we could palpate. Her expansion is within normal limits for the patient. And so I palpated and auscultated the point of maximal impulse. which is located at the 5th intercostal space on the left sternal border of the chest wall. Now we're going to assess the patient's jugular vein distension. We can tell just by looking at the patient that she does not have any jugular vein distension, and we can palpate to see that there are 3 positive vein pulsations on each side. We're going to auscultate the patient's heart. So the patient has a normal heart rate within normal limits, which is 73. The patient also does not have a murmur, and her heart sounds are regular. Now we're going to palpate the patient's abdomen and also listen to see if we can hear bowel sounds. Off camera, we looked at the patient's skin color of her abdomen and noted that it was symmetric with the skin tone of the rest of her body. So now we're going to take a listen. So she has active bowel sounds. We're just going to palpate the patient's abdomen as well and feel if there's any tenderness or rebound tenderness, and if there's any palpable abdominal organs that we could feel, like the liver or the spleen. So we took a look at the patient's skin on her legs and on her feet off camera, and it is the same skin tone and color as the rest of her body. The hair is shaven on her legs, so that's normal for her age and gender. We can also feel her pedal pulses. They were strong. And then we also had the patient move her legs forwards and backwards and had her move her toes to see if she had free movement and full range of motion in those joints. And she did. That's within normal limits for the patient. And we also were able to palpate the muscles, and she's able to walk freely on her own. There was no muscle abnormalities noted upon walking and moving. We assessed the patient's hips. We had her stand up and look to see if she was able to walk freely without any tenderness or pain, and she was able to. She has full range of motion in her hips. There's no swelling or edema that we could see, and there was no muscle tenderness upon palpation. Our musculoskeletal assessment, we noted that there was no abnormalities for this patient. Now we are going to do a neurological assessment on the patient to see if she can determine sharp versus dull sensation.
Dull. Sharp. Sharp.
Okay, do this one.
Sorry. Dull. Sharp. Sharp. Dull.
Okay, so she was able to do that without any problems. Now we are also going to check her fine motor skills, so we're going to have her touch her thumb to her fingers like this. Both hands. Okay, now we're going to do 2-point discrimination. Tell me if it's 1 or 2.
1, 2, 1, 2.
Okay, so she did good with that. As we know, the sensation is decreased on the arms and increased on the pinpoint of the fingers. And also going to see if the patient is able to touch her finger to her nose and then touch my finger as I move it throughout her visual field. Alright, so we can see that the patient didn't have any problems with that. And then we also checked her deep tendon reflexes, and all of those are within normal limits. And as we stated earlier, she didn't have any problems with her spine. Palpation was normal with her bony prominences. She didn't have any pain bending over, and she didn't have any concerns currently about her spine. She also has full range of motion in her spine. We also had the patient walk back and forth for us to check out her gait, and her gait is within normal limits. She doesn't have any problems walking. She doesn't stumble or fall over when trying to walk, and she has good balance. We did the Rumberg test earlier today, and she was able to stand and not fall over with her eyes closed. So that's going to conclude my complete adult assessment.